From the beginning, there was a feeling of something doesn't click about this. This is not it. Everything from the start looked fake. But since January, late January, and definitely February 2020, before anything happened outside of China, countries were shutting down as if there was some horrendous monster knocking at the gates and trying to get in. The level of fear was very, very high. What caused the panic? It may be instructive to look back at what happened in Wuhan. First reports of a pneumonia outbreak, December 31st. On January 7th, the Chinese scientists all managed to sequence the virus causing this outbreak, and the sequence was published on January 11th or 12th of 2020. In Wuhan, a city of 11 million people, give or take. So I don't know if one person dying from pneumonia in Wuhan is a cause of concern. Maybe there was a lot of stuff behind the scenes, but it was never published. Maybe people assumed that there's a lot of stuff going on behind the scene, but to this day I have not seen any of that stuff. So nothing from Wuhan justified concern. And that is in fact what the WHO said at the beginning, and the WHO was not unimpressed. And actually a committee went to Wuhan and returned unimpressed. And I think that's the truth. I think they really didn't see anything that justifies declaring a global pandemic. Because I'm looking at the data, I'm looking at the stuff that came out of Wuhan, and I see nothing except for fake news, rumors, which all turn out to be false, and the official numbers, which are simply unimpressive. You also kind of have to ask yourself, after they opened up, I mean, they declared victory on COVID, and then they opened up, and nothing happened. Nobody's in the hospital. The quarantine sites are ridiculous. You know how they treated most of these COVID patients? Chinese medicine, doing Tai Chi to heal the patients, and the patients themselves doing Tai Chi to heal the nation. Much like Fauci with his on-off masks. It's pandemic theater. What caused the panic? If we look back at the reason for all these policies, why do we have these policies? Why did Norway and Denmark decide that they were over this? Because we all feared that we're going to get what Wuhan got. You don't want things to turn into Wuhan, but what happened in Wuhan? It's really unclear if Wuhan got anything. I mean, it really looks like a Chinese city in winter when there's hysteria and too many people are going to the hospital. Is there any documentation in the data of like large amounts of death in China? Sure, they can hide stuff, but for example, if you want to see how bad China is at managing stuff, look for unofficial videos from the floods they had this year. Yeah, here's a terrible example, which I'm not going to show to the end because it's really disgusting. This is not something we can find for the Wuhan outbreak. What caused the panic? It's kind of like an autoimmune disease. The society thinks that the danger is huge and inflicts damage on itself to prevent the expected damage from the external source. But if we look back, we were not able to stop the virus and nothing terrible happened. You can say there was more deaths than usual. I'm not even arguing about it, maybe. But was there an outbreak? Did you see an outbreak? Did you see people getting like super sick in clusters? Because that's an outbreak. Like SARS. One person gets super sick and everyone around them, or 50% around them, get super sick. And if you don't contain that, then your entire population is going to be defunct. But this was not it.
Makeshift hospital. So, armed to teeth. Wuhan has converted 3 public venues into temporary medical centers to address the dire need of hospital beds.
Look at the quarantine facilities. The quarantine facilities are...
This enormous makeshift hospital is converted from an exhibition center.
I know that they're in that's supposed to be the go-to solution, but it's dumb. If we ever had a really bad disease, that would be a really dumb solution. If you suspect that you're sick, being in a quarantine facility with other people that are suspected of being sick, assuming that only a few of you are actually sick, but the virus is really transmissible, then you're all going to get sick. See, if there was an actual epidemic, I would refuse to go to a quarantine facility. I will lock myself in my home to save society. I will lock myself in my home to save myself and society. Capitalism works. We want to live. When we see an actual pandemic, when we see actual death, when we see actual harm, we act. And in this case, from the beginning, there was a feeling of something doesn't click about this. This is not it. There's no reason. No reason. And we have to return to reason. Thank you very much. Have a great